Welcome everyone. How are you? Good afternoon. I'm Lana Kerr. I'm the CEO and founder of Lumis Skincare, and we're looking forward to an amazing live. We're going to be talking with Dr. Stanley Okoro, plastic surgeon in Georgia. Georgia Plastic. Hi guys. Welcome. All right, we're looking for him to join, to invite him on. We're ready. I'm looking for him to join. Let me look for him here. Hold on, let me let him know. Hi. I hope you guys are having a wonderful day. It's so beautiful here in Florida. I love this time of year. Okay, Georgia Plastic joined. Let's see, let me add him on. All right, let's see what happened. Hi guys, I haven't done this in a minute. For some reason, let me go here. No, let me request Georgia. We added Dr. Okoro, I just added you as a moderator. Oh, but aren't you seeing it, the request? Hold on, let's see. Okay. Let's see. Dr. Okoro, it will be joining in a second. Hold on.
Georgia Plastic.
For Georgia Plastic. You are
We're here. We're here. Hi there, Dr. Okoro.
Hi,
How are you?
I'm well. Are we good?
Yes.
Good.
If you go to
Well,
Welcome everyone. Thanks for joining our live. We have such a great topic to talk about today. We're just getting Dr. Okoro's getting settled. He just finished surgery. Look how, by the way, look how sharp he is. From the day that I met him, always sharp.
thank you. Thank you. I'm trying to see how to see what's going on here. Yeah, okay, set.
Yeah, we're on. You're on,
I
Dr. Okoro.
see it. Okay, yeah, I want to see you as well on my phone and this. I can see.
Okay. Well, welcome. For those of you who don't know, Dr. Stanley Okoro is a board certified plastic surgeon in Atlanta, Georgia. And we have a very exciting conversation today. You know, it's Menopause Awareness Month, it's Breast Cancer Awareness Month. And I just like the focus that is being paid to women's intimate health, the issues that women have. And what we're going to talk about today with Dr. Okoro is how he is helping his patients in this regard. And, you know, as a plastic surgeon, you know, when we think of it, we always think of just, you know, our face or maybe our body contouring. We're going to focus on things that affect our intimate health. So I'm going to turn it over. I'm going to ask you a couple questions, Dr. Okoro. And by the way, stay tuned for the end because we're going to announce a raffle or a giveaway that you can participate in, and you're going to get some great products sent to you. So stay tuned for that. So we're going to be on together for about 20-25 minutes. We're going to announce a giveaway, and so that you can participate. Okay, Dr. Okoro, we already know what happens to aging on our face and our neck as we age.
Right.
But now, in terms of women, particularly, how does aging affect our intimate parts, our intimate life?
Well, first of all, thank you for inviting me to this live discussion. I'm honored to be here. I've always loved your company, what you guys do for our patients' skin. It's always, I love CO2 Lift. I wish I discovered it early. But you know, aging affects every part of our body, including the intimate, private part of our body. And as a plastic surgeon, I discuss these issues with a lot of women, and it affects their confidence. Aging, as you age, everybody knows you lose fat and collagen on your face and all over your body as well. The same thing happens on the intimate part of our body. So you start to sag a little bit. You lose the youthfulness of the area. Mm-hmm. And That's what happens with aging, and that creates opportunity to do other things to rejuvenate the area. So
Yes.
that's what happens.
Yes, and as a woman, I'll tell you, I've noticed when I was in my mid to late 40s, I certainly did notice a difference in functionality of,
Absolutely.
my intimate area. I was with my husband and I could tell a difference. It just didn't feel the same way. And I really couldn't put up my finger on it. My first instinct was to say that he's shrinking. And I know you do stuff for that too. So, but we're not here talking about men today, guys. But by the way, there's things that men can do to change that. But that was what I immediately thought about. And then just speaking with my gynecologist, and what she educated me on was the fact that, blood flow slows down, ladies. Blood flow
Absolutely.
slows down. So our clitoris that needs blood flow to operate optimally can start to shrink. And as Dr. Kerr says, we lose elasticity down
Yep.
there. I mean, and the looks of it change aesthetics, but I mean, for me, the functionality was a key. That started diminishing. So now we're going to talk about some of the solutions for that. So
That's
what are
right.
some of the things, I mean, and I also want to point out, I know we're talking about, the vulva, the vagina, and we're going to talk about some things that you do for your patients, but also too with weight gain. And I know that you offer, weight loss services, and I'm glad so many more offices like yourself are doing that, because it does affect a woman's confidence. Tell us a little bit about what happens with weight loss or weight gain as we age.
So, as you probably know, one of the hardest things that people are doing right now is the semaglutide shot, which is a skinny shot. By the way, I love it because it gives you good confidence. You look great. But once you're on it, you're losing weight, you're losing fat, volume, collagen, everything is getting loose. So, how do we address that? And I encourage people that need to lose weight to do it. Don't just do it, but you gotta do it right. So as in the intimate part of our body, as you're losing that, we need to tighten the skin a little bit, okay, on the inside and on the outside. So we use, for the inside, we like to use, there's different options. So we have surgical and non-surgical options. So I want to talk about the non-surgical options first.
Start with that.
And no matter what you do, you need to have good blood supply, which is what I love about CO2 Lift, because it helps rejuvenate and bring more oxygen to the area. For the inside, we use radio frequency energy such as Tamiva to tighten up the area. But then what makes it better is when you have good oxygen to make things heal better.
Mm-hmm.
So that's one thing I like about the CO2 lift as well.
Yeah.
For the
Well, before you move on from that, Dr. Okoro, let's talk a little bit more about that aspect. So what we're addressing here, ladies and gentlemen, for you to know is that the tissue in our vaginal tissue is as thin as the skin under our eyes.
That's right.
And that area shows age first. We all agree on that. So I've heard from a gynecologist before that a woman's true age can be seen in her vagina.
Yes.
Just because you're really not doing anything to treat it. You're doing things on your face, but inside that skin that tissue
Thin,
becomes thinner.
very thin, paper thin. It's
Yes.
just so paper thin, yes.
And then dry. So he's talking about the Thermiva, and by the way, I know very well the creator of the Thermiva, Dr. Alansad too, and the point is it's controlled damage to the tissue to now elicit a healing response. So that's what Dr. Okoro has in his office, the Thermiva, and using it, and he uses it and pairs it with the CO2 Lift V. That's doing the same thing from a different approach, because what I like to tell people is that the CO2 Lift technology can close a non-healing diabetic ulcer in as little as
Yes.
So that is really speaking to how we can regenerate the tissue. So Thermiva along with this would be a great pair. And for those women who may not feel like they want to be as invasive, he has a CO2 Lift V that you can do also as a standalone, that you're going to get, the tissue is going to feel thicker. I want to talk about this, Dr. Okoro, tightness, right? So tightness is something I don't, address, that's more muscle. When women say they feel tighter after Thermiva or after CO2 Lift, what are they actually feeling? Do you want to speak to that a little bit?
Yes, so like when you lose volume and the togetherness of the tissue, It gets so besides Tamira, I also want to talk about like vaginoplasty to make the area tight as well, because not Tamira may not be for everyone. There's some people who have so much loose tissue there, and things have stretched from even pregnancy and childbirth. Don't forget that, right?
Yes.
We mentioned aging and weight loss. Childbirth will stretch things out, and you want to bring things back. No, but the point here is no matter what you do, surgical or non-surgical issue, you need oxygen to make things heal and feel better.
Yeah.
With the Tamiva stimulates the collagen to come in, but if you don't have enough oxygen in the area, it's not going to heal very well. So when people are loose in the area, they don't have the confidence, they don't want to engage in certain activities with their loved ones or their husband, their boyfriends, or whatever, and just you have the loss of libido. There's so much to unpack here, you know.
Yeah. Oh, for sure. I mean, so let's talk. Okay, so Dr. Kerr mentioned some non-surgical options. He is doing Thermiva. He has, I don't know, what are other devices do you have in your practice?
So
is that the one?
For the area in terms of the inside, we do have just Thermiva for that.
Okay.
There are other radio frequency energy that can be used. Some people use laser. We don't have the laser because we like the Thermiva because it has the radio frequency energy devices are much better because they have less downtime, and our patients can be active the same day.
Yeah.
That's why we don't use the laser. On the outside, we have Morpheus, which we can talk about later to kind of tighten up the skin on the outside as well.
Yeah. So I like those options, you know, that you have. And you mentioned vaginoplasty, and I just recently did one.
Yeah,
so I did mine.
Thanks for sharing that, actually.
I mean, I think, no, in terms of, so why did I do it? Many women say, well, why did you do it, Lana? Because I have the CO2 Lift V. I mean, my lubrication, and we didn't really talk about the tissue. We'll talk about that, but I have great lubrication. I feel like my tissue is thick and healthy. I know it. But as you age, as Dr. Kerr mentioned, those muscles get lax. And really, you know, as much as I wasn't at the point in my life that I thought, oh my goodness, because they measured the pressure of the vagina, and mine was a 6. Usually people start a vaginoplasty when it's between a 0 and a 3. So that's when it's really just loose. So that's in the middle. But I'm telling you the benefit, ladies. Let me tell you something. As you age, first of all, the angle changes, it's not as tight. By doing that, you will get a 20-year-old experience. And I don't know if all of you can remember that, what that could be like. But think about the experience you have now as you're older, but with the functionality of a 20-year-old. That's what a vaginoplasty does. It really,
vaginoplasty really, it brings the muscle closer. It makes the space a lot. It's just a complete rejuvenation of the whole space, actually, because when the other thing that we didn't talk about is when we do the vaginoplasty, we also make the pelvic tissues tighter as well.
Yes. Oh my gosh. So the process for that, ladies, is that it typically takes, after vaginoplasty, it typically takes about 8 weeks to start, where you can start doing a softening exercise. Because the CO2 Lift V, it took 5 weeks for me, and then you soften it, meaning that you need to get it where you can put something in it. So you have to kind of use dilators. Can you speak to that process, Dr. Okoro? Like, for instance, when you do the surgery on a vaginoplasty, how long does the surgery typically take? What are some of the things that a woman may feel right after?
So the surgery, depending on what you're doing, sometimes we combine it with labiaplasty or clitoral hood reduction. But vaginoplasty is normally takes about 2 hours or less. We always combine with what we call perineoplasty.
Yes.
Let me just kind of talk about, a lot of people may not know what CO2 Lift does.
Okay, yes, let's talk about that.
That's really, because no matter what you do, you need oxygen to heal. CO2 Lift, what it does is it kind of stimulates your body to put more oxygen in the tissue where you need it.
Yes.
Wherever you put it, you're gonna have, that's just the simplest way to explain it, is wherever you put it, your body is going to release, your hemoglobin will release oxygen into the tissue. So this will heal faster, recover faster, and you have a much better result. That's why I like to combine it with all these procedures, whether it be vaginoplasty, tamiva, or even labiaplasty or
Yes.
perineoplasty. I just
I
want
love that you're
to
saying
make
that.
sure that people understand what we're talking
Yes. So
about.
it's a gel, people. A gel that you apply anywhere on the body. There's a special one for the vaginal area, the vulvovaginal area, because the pH is different and a slightly different formulation, but it doesn't have, there's no pain involved. When you apply it down there, it's mixed, inserted pretty much like a tampon, and then you leave it on, go to bed, wake up in the morning, it pees out. So it's very simple to do, and there's
At
no
home,
downtime.
you do it at home.
And you do it at home,
Yes.
which is what I like and what many women like. But
Yes.
Dr. Okoro, so when you do the surgery, you say, well, and you couple it with another procedure, which I like,
Yeah.
because that's what I did too.
Yeah, most likely, like, so I like to look at things from a deep past what you see, bringing the skin and the muscle together. How about the mucosa, the inside? I like to, like, in an ideal situation, I like to stimulate collagen in the area, do it so it heals well, and the area, the tissue itself looks beautiful. The inside and the outside is very important. So a lot of times I want to combine it with labiaplasty or maybe skin tightening on the outside with like my micro needling with RF. And my favorite one is Morpheus 8. I'm sure people have heard about Morpheus 8 from Inmode. I love that because you can treat the whole area and just rejuvenate the area. And when you slam the CO2 on it, CO2 lift, things heal so well. You have much less downtime.
Yes, yes. Talk a little bit about the clitoral hood reduction for those of those listening who may not understand what that is.
So some people have extra skin that is covering the clitoris, or even sometimes it's so much it covers the whole area. So we just kind of remove the excess skin on the sides, on top of it, not to expose the clitoris completely, but kind of allow it to do what it needs to do.
Yeah.
For
To
your
just
own.
get a little bit more exposure, so easier access to help with sexual pleasure.
Yes.
Yes, I love that. Okay. So just we've talked about the non-surgical options for inside and the tissue. I think the tissue, why it's important too, regardless of the treatments in a clinic like our need at home. Yeah, they need at home care. I love that. Thanks for pointing that out. So one of our listeners here. But I think that the tissue health also, which you mentioned too, Dr. Okoro, is so important because that's where we get lubrication. When you have healthy tissue, you're going to lubricate and you're going to have sustained lubrication.
That's right. One of the things that we didn't talk about is the aging process. You have more dryness, very, very important. And the CO2 lift actually helps with that. The Tamiva also helps with that, but Tamiva with CO2 lift is like a multiply effect for the result that you're looking for.
Yes, very good. And so, ladies, when you have healthier tissue, you're going to have less infections. You're going to have, again, just it feels better down there. And sexually, you're going to be able to have natural lubrication. So that's very important. We talked about vaginoplasty, what he's doing for his patients inside, tighten up the muscles, even possibly clitoral hood reductions, and we're talking about a labiaplasty. Let's talk a little bit about your labiaplasties. Just for women to know what's the difference with that and the vaginoplasty.
So yeah, a lot of times people don't know the differences between people. Patients come to me and ask me they want a vaginal rejuvenation. I said, well, are we talking about the inside or the outside? Mm-hmm. So when we're assuming for just simplification that the vagina is like a hole like this, okay? After pregnancy, childbirth, things stretch out. And with vaginoplasty, we were making the inside smaller. Mm-hmm. That's what, so going from this to that, that's vaginoplasty, making it just like making it smaller. Labiaplasty is on the outside. To sometimes we have the stretching or excessive skin There's labiaplasty of labia majora or labia minora, but most of the times on the labia minora, the inside lips. Many of our patients have problems with exercise, walking, riding their bike, or excess skin that has too much friction and it causes pain. So that's the most common reason why we do labiaplasty. Sometimes we do both.
Okay.
Sometimes people don't like how it looks. That's another reason to do it. But whenever you do, I like to. So it's not just removing this, doing the surgery. I want you to heal better. I want you to look better. I want you to feel better. So
Yeah.
I like to combine all of those features with any of the procedures that we do.
Very nice. What separates in terms of, okay, your labiaplasty, typically before using the CO2 lift with your labiaplasties, what was your typical downtime?
So labiaplasty by itself, it takes about an hour to do under local anesthesia, which means awake anesthesia. You don't need to go to sleep. Patients would take about a week or two, depending on what kind of work that they did. But most of our patients take about a week off from work, right? Because of the healing. The healing is about getting nutrients and oxygen to heal. We add, some people take 2 weeks off. That's average because you can't walk, can't sit down properly. You add a CO2 lift on it, it multiplies the effect of healing. And most patients will be able to go back to work sooner because things are healing faster than it would have. So I highly recommend it. Not just, I don't want to talk about other things, but I love the CO2 lift in the face and the body, everything else. But today we're talking about the intimate area. So I'm going to control myself and stay in that area. But it's like, I don't do Morpheus on the face without CO2 lift anymore. Like, you got to have it,
Yeah. No, the healing time is so, wait, it says how long we can resume workout and other normal activities after the procedure. Now, if we're talking about labiaplasties first, and then we'll ask about vaginoplasty.
So labiaplasty, I restrict my patients for about 4 to 6 weeks for exercise, though, because I don't want any friction to create any, no matter how well the wounds heal or the incisions heal, we don't want to test it. I'm very conservative when it heals, so I still have my patients not do any walking or sitting down exercises for about a month. For vaginoplasty, basically that doesn't matter because on the inside, the only thing is there's no sexual activity for about 6 weeks.
Yeah. Yes. Well, and then now with them, I just had one, and it's 5 weeks. I started where you can start putting something in and dilators to kind of bring it back to what size you kind of want it. Very, very nice. Now, Dr. Okoro, I know we're coming up to the time, but I wanted to also ask you just, I know that you're a surgeon and you focus on surgery and you do energy-based devices, but even just for sexual health, like one of your patients come in for sexual health, how are you using the CO2 Lift V for your patients?
So you can use it with or without any procedure. Okay. So I have a patient I'm originally from Nigeria, so I go to Nigeria. One of my patients orders it from Nigeria, just wants to use it, right? So anybody that I think after age 40, most people need it, but we also have younger patients that it's called prejuvenation, like preventing aging. Let me say it again, preventing aging. Aging is inevitable, but you can actually slow down. For intimate health, I like to use CO2V to kind of slow down the aging process, especially now that people are doing weight loss shots, semaglutide. You're losing tissue. You want to increase collagen there. You want to increase oxygen there. And so with or without any procedures, you can still use it.
Yes. And even so many young people may be on antidepressants or they're taking sinus medication. Sinus medication is going to drive this passage, but it's also going to reduce it down there. So if you want to just enhance that for yourself, slow down the aging process, as Dr. Okoro was mentioning, this is an option. Wow, Dr. Okoro, I love what you're doing for all your patients, but especially what you're doing for women in this area and taking the lead in it in your area as well. We have a special, and any questions, feel free to, we're wrapping up, but I had asked you guys to stay on. So here's what the promotion is. Dr. Okoro we're going to both post this video to our page. On the page, I want you to follow, if you're not already, follow both pages to qualify. And then you're going to need to tag a friend and say why you should win. What are we giving away? We're giving away a 5-count V, and we're giving away a 3-count Pro. And we'll get that.
Wow, that's a big deal. That's a big deal.
That's a big deal. So you're going to have to do it. Dr. Kerr's office is going to announce the winner tomorrow through his story, and we'll get that shipped to you. So 5-count vulva vaginal CO2 Lift V and a 3-count Pro, which you can use on the face or anywhere else on the body.
That's a big deal. That's a big deal.
So we're going to be doing that. He's going to be announcing it on his story tomorrow, and we'll reshare it.
Can you state the criteria again so people here, they have to follow both pages?
Both pages, they have to make a comment on this post that we're going to be posting, tag a friend, but in it say why you want to win.
Why you want it, right?
Yes. Right?
Awesome.
So, and then it's tomorrow. He's going to announce it around the same time tomorrow. So
at 12 noon. Is there any questions on the live that I need to answer? Can you check?
Let's see. Let me see. Hold on. I think I had people were asking questions along the way, and I brought that in, Dr. Okoro.
Yeah.
We covered.
Yeah, people don't like to talk about this stuff. I don't know why people are ashamed to talk about their body. But
yeah, and then you know what? For those of you who have any more questions, you can DM us, and we will respond to you. I know that I'm just glad that this conversation is being more normalized. It's a very normal, healthy conversation. And we need to have it more often. And this is a medical doctor who is helping his patients with a very real problem. It's about quality of life. So let's have more of these conversations. Ask your medical professionals about this conversation. Of course, you hear Dr. Okoro. He's a phenomenal surgeon. He's helping women with this in this area. Certainly for those of you in Atlanta, and I know people fly to doctors all the time. Look at his page, check him out. He's a phenomenal artist of what he's doing for women and men, top to bottom. So there you go. Yeah?
Thank you very much.
Dr. Okoro, I want to thank you so much for taking your time out. I know you're a very busy man, and you took the time out. We spent some time together just helping people to understand more about what you do and how you're helping women, how aging impacts us, and what you're doing to solve this problem for us. And thank you so much for you and your staff. By the way, he has a wonderful staff who work with him, so check them out as well.
I appreciate it. Thank you very much, Lana. If you need more information, just visit georgiaplastic.com for more information. Thank you. Have a wonderful day. Looking forward to seeing you soon, okay?
Yes, all right, awesome. Yes, for sure. All right, guys, take care.
Bye.
Bye-bye.